Hi, did you know that a decrease in ankle mobility increases your chance of having a hip, a knee, or an ankle injury, especially during athletic or sport activities? Here's a quick screen that you can do at home to measure the symmetry of both of your ankles. You need a wall or a stick, something that's going to stay steady and still. Put your toes up against that object and lean forward to tap your knee on the object, keeping this heel flat. Okay, that's the most important part. Okay, so this is no problem. Tracy's gonna move the object a little bit farther away and try it again. Slowly knee forward, keeping the heel flat. Again, no problem for her. A little bit farther away until eventually that back heel pops up. Okay, so you've reached your limit. You want to measure the distance that you can successfully complete this activity. Compare it to the other side. They should be close, almost identical side to side, and the distance should be at least 4 inches. So if you notice that you had an asymmetry on one side versus the other, the first step is to mobilize the soft tissue on the back of your leg, your calf and your Achilles tendon. Okay, you can do that with a foam roller. Tracy is propping herself up with her arms, rolling up and down all along her calf. This should hurt, okay? You should feel tenderness, and if you find points that are more tender than others, stay there and try to work through that for a couple of strokes. If you can handle this progression, cross your unaffected leg on top of your affected leg for a little bit more of an intense massage. Do this for 2 minutes. Every day. After you've done some mobilization to the soft tissue, your calf and your Achilles, it's time to stretch out that soft tissue. Okay, so how you do this is you put both hands on the floor, knees on the floor, all fours. You're gonna lift your butt up into the air, and then we call this pedaling it out. Okay, so you push one heel down, feel a stretch, push the other heel down, feel a stretch, push the other heel down, feel a stretch, back and forth, just a nice slow pause, 1 to 3 seconds on each side. Okay, come back down, take a rest. Same position, kind of a different stretch. Instead of a short, intense stretch, this is gonna be a lower load, longer duration stretch. Same position, butt into the air, slowly trying to push both heels flat, okay? You're gonna feel this all up the back of your leg. If you can't get your heels all the way down, you can use a book or something hard as a riser underneath your heels. Another technique that you can use to try to increase your mobility here is called a joint mobilization. The treatment for this is going to be the exact same motion as the test. The difference is that we've attached a taut rubber band around her ankle. So as she does the exercise where she leans forward trying to keep that heel flat, this band is holding her tibia in place, and she's able to roll forward. She gets a little bit of an ankle mobilization. And then afterwards, if we were to take this band off, it would feel much easier.